And now, all the way live from our KUAM studios in Indigenous Huttman, ladies, please welcome Jason Solis.
All right, thanks so much, Chris. Welcome to The Link again, everybody. Middle of the week. It's a Wednesday, and we are going to check in right now on the KUM News Zoom room with a good friend of the program over here, someone who has dedicated his life to being a learned expert on the human system so that you can take care of yourself. Dr. Tien Trinh from American Medical Center. Doc, good morning.
Good morning, Mr. Salas.
All right, very nice to have you here, and very appropriate because we talked with some of your colleagues a couple weeks ago with respect to physical therapy on how we can take care of our beloved Manumko, our elderly generation. But we brought you on today because we want to talk about some of the medical concerns, maybe some of the medical trends that the island's Manumko have, especially in what has been just an absolutely crazy year. So obviously, I would say COVID is probably the main concern for our island's elderly. Would that be correct?
That is correct. That's concerned not only on Guam, but pretty much everywhere.
Mm-hmm. And when it comes to geriatric care in general, even pre-pandemic and everything like that, what are you seeing as far as maybe some of the commonalities? Because I mean, it's such a well-known fact that we have a high rate of heart disease here. We were talking about arthritis yesterday. Hypertension, things like that. But are there any improvements over the years as far as quality of life or people taking care of themselves?
Well, there have been significant improvement in terms of healthcare for the elderly and pretty much for everyone. As you can see that the life expectancy of people has increased over the years, so the healthcare has improved. But one thing that we like to do with our senior program is that we want to really change the way how people view healthcare. The traditional model is that the only time they see the doctor is when they get sick or they need something. What I want to help people to understand that we don't want to see people when they're sick. We want to see people when they're well. Mm-hmm. We want people to come and see us when they're well so that we can work with them and work with our patient to keep them well. So the idea is we're seeing our patient on a regular basis. We focus on health maintenance. We focus on disease preventions, and we work with our patients and the family to keep our patient healthy. Mm-hmm. And that is the slightly different model. It's hard for people to understand to come to see a doctor when everything is fine and they don't really need anything. But that is the best time to see a doctor so that we can keep them that way, so that we can keep them out of the hospital, out of the emergency room, out of the urgent care. And that's a different kind of thinking and different kind of mentality. And it's still hard for people to grasp, but it's slowly people begin to understand this concept and begin to focus more on health maintenance and disease prevention.
Mm-hmm. I'm glad you phrased it that way, Dr. Trinh. I thought that was very effective because so many people like on island, they only go to the doctor, and probably maybe in other parts of the world as well, but they only go to the doctor when they think something's wrong or something, perish the thought actually is going wrong. But we talk a lot here on the show about having your own dedicated physician, and we say, your doctor and someone that is familiar with your case and, the meds that you have taken over the years. As people begin to age more and more and say, like, as they approach retirement age, if they already have a family physician, should they stay with that person into their later years, or should they actually maybe say, okay, I'd like a referral to a specialist who specializes in like care for older people, or is it just better to stay with your same physician throughout your life?
I think the relationship that a senior develop with his or her physician is critical to that care. But again, not all physicians are comfortable dealing with the elderly. The requirement is different. The elderly population tend to have multiple diseases, And sometimes is if you're not used to that kind of complexity, it's difficult to care for the elderly. If I'm an internist, there are different specialties in medicine, but internal medicine focus on older adults, and especially in people who have further training in geriatrics, focus more on the needs of the elderly. If you on the island, it's hard to find a geriatrician, but if you can find an internal medicine or an internist, and you should continue your relationship with that doctor. And it takes time to understand a person and his or her health. And it's always good to maintain that relationship over time. And to me, it's critical. If you have been seeing a family practitioner or over the course of many years, and you feel comfortable with that person to discuss your health with that person, stay with that person. Stay with the same physician who understands you, who knows your nuances of your health is very important to you. But again, like I said, if you can find an internist, but you've been seeing a family practitioner for many years, stay with that person. The key is maintain that relationship. And most doctors, if we don't know how to deal with something, we will send the patients to someone who can help the patients. So, I mean, our goal has always been to care for our patients. To answer your question specifically, stay with your doctor. That long-term relationship is critical to maintaining your health.
Well, medical records can be transferred from physician to physician, and they are all the time. But your own doctor probably knows your best. They know your history and the medical history of your family. So, I mean, very sound advice, to be sure.
Yes.
Okay, Doc, I want to ask you one thing, because one thing that I know as I get older, like I'm in my, I'm approaching my late 40s, but I know that my parents, as they've aged, and relatives of mine, they've said as they approach retirement age, like around maybe 65 or even later, is some of them said they're like, man, from the moment I retired, that's when I really started developing, some minor health concerns, even some major health scares. And some people said it's because when you retire, you're not as active anymore. And, you especially like if you work in the corporate world and you're just used to going 200 miles per hour over and over and over for 40 straight years, throughout your work life. Can you maybe talk about some of the mental components you have to have when you eventually like slow down and adopt a new, maybe less intense lifestyle and everything like that? How staying active and, like keeping your mind fresh and everything like that, how that mental state can actually affect your physical being?
Maintaining an active lifestyle, both physically and mentally, is critical to our health. We have to realize that our body ages over time. Okay, it's just like a machine. And the problem with all of us, including myself, I have to admit, is that when we're younger, we tend to not focus so much on maintaining our body's health. We have family, we focus on jobs, and a lot of time we kind of ignore our body until a little bit later. So my advice to everyone is that don't wait until you retire. Start focusing on your body, your health, even while you're working, even when you're in your 40s, in your 50s. And because your body, like a machine, it needs attention. So, but if you haven't done that and you hit an age of retirement, maintaining an active lifestyle is critical to your health. Let's talk about physical health. Stay active. You don't have to go out there and run and go to the gym and do weightlifting and do serious exercises. Simple walking. Keep that muscle moving, keep the joint moving, keep the joint lubricated. Just a simple daily walking, 15, 20 minutes every day is important um, um, for your overall health. Also keep your mind active. Read a newspaper. I told my mom, read a book, do crossword puzzle.
I was just about to say crossword puzzles. I mean, that's a great mental exercise.
Yeah. Keep your brain active. Keep abreast with what's going on, and in your neighborhood, on the island. Get involved, and that's also important for you. So just we are human. We are creatures that require interactions with our fellow human being. So don't stay inside the house. Go out there, be with your friends. Even when you retire, call your friend up once a week, twice a week. Going out with friends. Talk about whatever is going on in your life. If you're interested in politics, talk about politics. If you talk about your family, but be engaged, and that is very important for your health.
All right, very nice. Now, I want to kind of take an angle that we don't normally take here on the program, but you were just mentioning how there aren't necessarily a great many physicians on island who specialize specifically in geriatric medicine, and we could probably always use more. For younger people that are watching this right now, or people that might be in med school or UOG nursing majors, or people that are considering making healthcare their life's work, what opportunities are there if they want to consider, not just geriatric medicine, but if they wanted to do work at the St. Dominic's, like the nursing home, or if they want to work at like one of the many private healthcare centers here, and you actually focus on taking care of people that are elderly, because I mean, certainly there is a lot of work to do, but from a career standpoint and everything like that, if you want to get into that line of work, what could that mean for you if you're considering that path right now on Guam?
If I can get this message to all the medical students, or any student who are interested in going to medicine, I would tell them that internal medicine, family practice, being a primary care physician is a great career. And primary care physicians are not dead. That is the greatest failure of the medical system in the US, is that the institution that are responsible to train future physicians, telling their medical students and their residents that primary care is dead in the US. To me, that is the greatest crime. Over the past 10 years, that's what I'm doing. I'm going to residency program, talking to residents, let them know that primary care is a great field to be in. There are fantastic opportunities. Given current changes in the healthcare system, it's a growing field, and none of that is very rewarding. But the problem is that we had chairmen of internal medicine, of medicine department, chairman of the residency program in family practice, in internal medicine, telling their residents that primary care in the future is dead. Going to a specialist, going to subspecialize, become a specialist. And that is what we're fighting against, this misconception of people who are in power, telling people who are training to avoid a career in primary care. Mm-hmm. And if somehow your program can access people, please let them know primary care is alive, is a great career, both for your personal well-being, but also financially. Primary care is not dead. It's growing and get better. And to me, right now is the greatest time to be a primary care physician.
Well, I remember, Doc. I mean, I'm old enough to remember maybe the tail end of it, and my grandmother on my mom's side would tell me that there was a time when family practice physicians would actually do house calls, and you had a set list of patients, and you would actually visit them, from home to home, and see not only the way they were taking care of themselves, but how they were living and the environments in which they lived and everything, which contributed to their overall health. So certainly, I mean, yeah, a very rewarding profession, I'm sure.
Oh, the concept of doing house call is coming back actually.
Oh, good.
Uh, this is a great thing about Medicare now is that Medicare actually will pay you to do house phone visit. And actually, one of the great things about American Medical Center is that some of our physicians, I myself included, I have done house visit to some of the patients on Guam who can't come to the office, who needs help. And I do that, and you are correct. I love going to a patient's home, seeing where he or she lives, and seeing the environment. It helps us understand the needs of our patients. And you said earlier when you first start this program that a few weeks ago you talked about physical therapy, and going to a patient's home allow you to see the environment that your patient lives in, and medicine is not the only thing that as a doctor should focus on. See the need, what if your patient can go up the steps, or there are other dangers around the house that patient had to maneuver to get around. See how they interact with that environment. See how they go into the bathroom, how they cook, and understand their daily activities. And so there's, you can identify the need for physical therapy, for occupational therapy, for other things, not just on just on the medical aspect that most doctors focus on. So I love going to the home. It helps me to understand my patient needs, and I enjoy going there.
Well, obviously, maybe even though people don't do it, physicians don't do it as often as they used to. Certainly, the passion for saving lives and taking care of those when they are that are most in need and everything like that has certainly not waned for your profession. But Doc, I wanted to kind of ask you now, like, how about the other side of the spectrum? Because it used to be that when things like telemedicine and some of the new innovations with technology and letting a patient actually receive medical advice through the internet, it used to be maybe people would judge the older generation very unfairly, and it's, well, that's a young person's thing because it involves technology and setting up a webcam and doing email and everything like that. It's very hard for some of our older citizens, but the older generation now is very, very computer savvy. They're very technology literate. So how is taking care of our island's older generation factoring into remote care or like telemedicine these days?
So actually, I was focused on telehealth way before this pandemic. And you are correct. Some of our senior had, they may have difficulty connecting using Zoom, or using WhatsApp, or using the technology that's currently available. But they have family members who knows how to do that. But actually, before the pandemic, at American Medical Center, specifically at our Manila clinic, we actually created a video conference room with a large screen TV, with all the equipment necessary for a doctor, specifically for a specialist who are not on the island, but our patient needs the advice of a specialist from the mainland. We actually create this room. It's functional, it's available. We can book an appointment for our patient to go there, and then we will connect with our network with specialists in the island that I set up for our seniors, so that they can have advice of these specialists, or even advice of a internist, someone who, a geriatrics who can help them, give them advice for their health. We've done this. Unfortunately, the pandemic kind of affect everything, And because the clinic was used as an urgent center to deal with the COVID pandemic, and the room right now is being occupied for COVID. But yeah, we already set this up, and we are quite ahead of the game, especially on Guam. And I hope that in the next couple of months, when the pandemic is controlled, we will be able to implement this program and really help our patient to access the kind of care they need that may not be available on the island through telemedicine.
All right. Well, thanks so much for the insight, Doc. I mean, we know our friends over at American Medical Center. I mean, you are learned experts in all areas of medicine. Obviously, you've got vast expertise when it comes to the technology side of medicine and everything like that. And when it comes down to it, I mean, you are just proud Guamanians who just want to care for other people. So we appreciate the insight, and we hope to talk to you very soon.
Can I make one last comment?
Absolutely, please.
Before we go about our Medicare program, I want you to realize that the key to maintain the health of our patients, our elderly patients, is not only the physicians. Actually, if you think about it, patients see the physician 2, 3, maybe 4 times a year. The key is the in-between appointment that we want to engage our patients. So our Medicare program, we actually hire, each patient is assigned a nurse. And this nurse reach out to our patient every month, just to check on our patient, making sure that they're doing okay, making sure that they're taking their medication, making sure they stay active, going out every day, walking, help them with their any question on their diet and some general question about nutrition, but engage our patient, checking on our patient, making sure that they're doing okay. And to me, that is a critical component of how we maintain the health of our patient. Is this connectivity with our nurses, and also in a way the connectivity with our physicians in between appointments. The idea is that we want to identify any problem that our patient have before it become a huge problem. We want to be able to intervene when the problem is early so that we can deal with it quickly and before it can affect our patient in such a way that we have no other choice but send them to the hospital. That is the success of this program. That connectivity with our patient in between appointment to help them to maintain their health. And if they get sick, to identify this problem early so that we can deal with it immediately and deal with it in the clinic and get them the necessary help before the problem becomes so severe that they have no choice but go to the emergency room. That's how we design our program, this kind of connectivity in between physician appointments.
And these resources are available right now if you are in need. And as Dr. Trinh said, everybody, make sure that you avail of your family physician. Make sure that you can minimize the amount of trips that you have to make to the doctor. Take care of yourself and see your doctor when you are feeling your best so you don't have to go to them when you feel your worst. Well, Doc, I would say, obviously you have dedicated your life to the study of the human system, and it's very, very abundantly clear that you truly understand the heart.
Mr. Salas, thank you so much for inviting me to be on your program. And I hope we can talk again in the future.
Absolutely. Would love to have you. Invitation's open anytime, Doc. You know that.
Okay.
All right. Thanks for
so
the time.
much.
Have a wonderful day.
Bye-bye.
All right. And please stay tuned, everybody, because there is more coming up on the link right after this. You're watching KUAM.
When we throw things away, where is away? What happens to our waste, and where does it go? As a community of small islands, the waste crisis is a large issue we want to bring into focus. Micronesia Climate Change Alliance presents From Our Nanas for Our Nennies.